Let's take you to the Western Cape, where the health department there says it has spent millions on diesel for its generators between April of 2022 and February 2023, in just 10 months rather, with the health MEC in the province, Dr. Noma French Mbombo, saying at least 120 million rand has been spent on efforts to keep the lights on during load shedding. We're now joined by Dr. Saadiq Kariem, Chief Operating Officer in the Western Cape Department of Health, for more on this. Thank you very much, Doc, for your time this afternoon. It's quite a hefty amount in just 10 months to spend on diesel.
That's a significant amount of funding, and obviously that funding could have been utilized for patient care. But over and above that expenditure, we've had to commit to installing inverters and batteries at 122 of our most needed clinics in the province, particularly in the rural clinics. And that expenditure will amount to roughly about 83 million rand over a 2-year period. And a further 73 million rand is what we're going to have to spend on photovoltaic systems at 12 of our bigger hospitals to try and just keep everything going, during load shedding. So obviously it has a massive impact on our expenditure, and indirectly, and therefore, in fact, quite directly, and our ability to spend that money on patient care.
Let's speak about patient care, because these are monies that are just dedicated to keeping the lights on, so you are able to offer essential services. How many hospitals are we finding do not have the necessary equipment that they need? Hospitals that are in desperate need of life-saving equipment.
So we've got generators, fortunately, in the province at all of our hospitals, all our community health centers, all of our community day centers, and most of the clinics. The ones that don't have generators at the moment is where we're installing these batteries and inverter systems. So luckily we have generators that obviously keep the essential services running. But it's obviously not ideal, and we have to reschedule and make sure that we schedule patient operations, etc., sometimes around the load shedding schedules, and that does get quite tricky.
Doc, this is not sustainable. I'm no accountant, but it is not sustainable, the expenditure of so much money. It is critical, it is essential. Are we thinking of different ways? So much is being said about installing solar. In fact, the finance minister saying, well, you will get rebates of some 15,000 rand depending on the equipment that you buy, or depending on whatever else that they need. So is the department looking at other options so that this money then does go to, the much needed saving of patients?
No, absolutely, and that's why we're looking at the photovoltaic system. They're not cheap, like you said. Using solar energy is obviously a part of our greening project as well, to be able to use solar energy. So what we're exploring now through these photovoltaic systems is utilizing solar energy on the solar panels and using that to power these hospitals. But they are extremely expensive at the moment. And I hear the issue about the rebates that will be coming in, but at the moment, our expenditure on just 12 of our hospitals for these solar photovoltaic systems will in fact come to 73 million rand. And that's only for 12 of our hospitals. I must say, though, we do have 10 of our hospitals that are currently exempted from load shedding. And despite the load shedding, we actually have very good working relationships with the municipalities. So if there's a crisis, or a hospital's generator fails, or for some reason there's some switch over problems, the municipalities have actually been switching the hospitals temporarily back onto the grid. And we've been maintaining that relationship, particularly with our municipalities. So big municipality, for example, like the city of Cape Town, we've got a very good working relationship with them that they'll keep hospitals on the grid should there be a switch over problem.
Doc, you spoke of hospitals in rural areas. How much of this expenditure did they enjoy?
So the 83 million rand for the inverters and batteries for 122 clinics is in fact all for the rural clinics, because obviously we understand that people in the rural areas have greater difficulty getting healthcare and accessing facilities. So that 122 facilities, clinics are in the rural areas. In the metro is obviously a lot easier because there are many more facilities and patients can divert, and we do divert our patients as well from one facility to another, because obviously they're in closer proximity. So we'll be spending that 83 million rand on, in fact, all 122 clinics in the rural areas The photovoltaic projects, the ones that I've spoken about at the bigger hospitals, those are largely also in the rural areas with 1 or 2 exceptions in the metropole. But other than that, those 10 of those 12 hospitals are in fact the rural hospitals. So the bigger focus of our focus, in fact, is going to be in the rural areas.
In terms of securing the infrastructure that you're going to be put in, we cannot deny where we live. Are you not concerned, or is there some level of concern that this infrastructure then may be uprooted?
We're very concerned. We know that, these obviously must have some sort of street market value. And so along with that, we've been beefing up security at our facilities as well, just to make sure, that we kind of protect the investment that we've now putting into place. But unfortunately, it's the reality of South Africa, where we are and where we live in South Africa, and that violence and the related, crimes are in fact part and parcel of what we live with, and our health facilities are not exempted from that violence. So we've had to invest additional funding in security as well.
Where do you procure the diesel from? Is there a discount of sorts, especially given that this has got to do with issues of health?
Yeah, yes. No, so we obviously procure centrally, and what we do is we fund that centrally. So from our provincial office, obviously we pay for that diesel. We procure it from the petroleum companies. We do the same for the medical gas. By the way, we procure that centrally as well, and then we redistribute that to our facilities. We also put in place a live dashboard, by the way. We've got a dashboard where our facilities can in fact go onto that dashboard, and I can, at the central point, I can actually have a look at each of our facilities in the province. I can see where their diesel levels are at and who is at a critical level. And based on that, we then, from the central depot, we then are able to move the diesel around. We've also got a tanker, a special tanker that we use in the province. And with that tanker, we can actually move diesel to facilities that are running very low on supply, and where we think the supply has become quite critical. So we are able to do that as well, just in case, facilities run at a critically low level.
Sure. Where medical gas is concerned, you're comfortable with what you have?
Yes, no, and during COVID, we've instituted quite a number of mechanisms to try and make sure that we have sufficient medical gas. We produce roughly about 90 tons that we use on a daily basis, and then we obviously make sure, and like with diesel, we've got a dashboard where we can monitor the levels of gas at each of our hospitals. We've got very good working relationships with AFROX. And during COVID, we were able to utilize that when they were moving the medical gas around from province to province. And, we hit that first wave very early on, in fact, in South Africa. And so and subsequent waves as well, we made sure that we were able to monitor our utilization of medical gas and respond appropriately, just to make sure we don't run out of medical gas. And those systems are quite critical. Without that, we'd really be pretty much blind to the needs of the hospitals, for both in terms of fuel as well as for medical gas.
Yeah. Doc, just before we let you go, in terms of the procurement processes and dotting the T's and crossing the I's, is the department comfortable that there was no wasteful expenditure where this is concerned? You mentioned you're not even getting discounts from the people that you procure the diesel from. You're comfortable that the books are balanced and clean?
That's an important question. Absolutely comfortable. We, in fact, 4th year in a row that the Province Department of Health and Wellness got a clean audit. So we're very particular about making sure that all the T's are crossed, that the I's are dotted, and that we can monitor and track that expenditure. And when the Auditor General comes around, obviously they will then check our books, they will check our expenditure, they will monitor all of that. So yes, we're quite comfortable that our procurement processes are up to standard, that the utilization of the consumables, in this case oil, gas as well as fuel, that is intended for the purpose that it is intended. In fact, utilized for the purpose it's intended.
Chief Operating Officer of the Western Cape Government Department of Health, Dr. Saadiq Kariem. Thank you very much, sir, for your time this afternoon.